Our work focuses on dating, domestic and sexual violence prevention. And we do that using a public health model called the Spectrum of Prevention. So that has individual level programs where we go out and do programs with young people in the schools. We do community awareness projects. We educate providers, people that work with youth. We foster coalitions and networks, all for the raising awareness about relationship and sexual violence. We also do organizational policy change work, and at the highest level, we attempt to work with community stakeholders, board of commissioners, to talk about policies that can prevent sexual violence.
We have coaching boys and men. We have safe dates, love notes, and Amy, there's.
If they're a community person or a professional victim advocate, and any kind of person really could get involved with a sexual assault prevention action team. So that's more for adults that are concerned about this problem. If there's an agency out there that we don't know about that's doing relationship and violence prevention work in the schools, middle school and high schools, we would love to get you into our prevention coalition, and so we track all the schools we are in and what agencies are in what schools, so that if we can't do a program here at the health department, we know who to contact in the community to get that need met.
The teens seem to really enjoy the programs. There's sometimes you can see them learn. They're thinking about things that they haven't thought of before, or they've thought of in different ways. So I think it really opens their minds. Getting it into the schools, because of what Amy had mentioned earlier. I think the schools many times are, they may be afraid what the parents are going to think or say about the program, because oftentimes it is mistaken that it's a sex education when it's not.
I think, to add on to what Erin said, having the adults that allow us in to talk to schools and provide teacher and provider education is we need to talk to them about how pervasive sexual violence and dating violence is. We're talking about 1 in 3 teens report some kind of a dating partner hurting them on purpose in the last year. That's a lot. When we talk about sexual assault, we're talking about 1 in 5 women and 1 out of 71 men experience a completed rape in their lifetime. I mean, that's a large number of people. So it's very pervasive. So that's what makes it a public health issue. Also, we know that there is a huge societal cost for sexual assault and dating and relationship violence. Besides the physical injuries, there's emotional and mental harm that's done. And also that can lead to long-term chronic health conditions later in life. Adverse childhood experiences studies report that experiencing relationship violence, even witnessing it as a child, even if you're not the victim of the violence, can have long-term chronic physical health conditions throughout the lifespan. So it's a huge societal cost. We're not even talking about criminal justice costs, counseling costs. So that's a problem. And also, these problems are never going to be solved just by criminal justice law enforcement alone. Most sexual assaults, relationship violence, dating violence, it's never reported to law enforcement. We're talking about 1 out of 100 rapes ever actually leading a conviction, 1 day in jail for the perpetrator. So criminal justice system alone is never going to solve these problems. It has to be a community, a holistic approach, a community awareness, changing social norms where people blame the victim. Say things like boys will be boys, or what was she thinking, she was drinking, what was she wearing. Those kind of social norms that are pretty common today. More common with older people, maybe a little less common. We're getting there, but we still have a lot of work to do to ever really end this problem.
Email would be the best way. You can email myself and provide my email address. So emailing or calling, and when you contact us, we'll figure out the best way, the best program that will fit your needs.
I think I would like to say that with violence prevention work in general, I'm talking big picture violence. Domestic and sexual violence are some of the root causes for that. And I think that this is something that we can see end in one generation if we can get to young people and get them to think differently. Also having adults that are good role models and that foster good communication with their children from a very young age. I'm talking like single-digit years about healthy sexual development, knowing how to ask for help when they need it, having that open dialogue with their students, and that's what we can help with parent trainings. If there was one area of our program that I would really like to do better is to interact with parents more, and so they feel comfortable talking with their children from a young age about what are their boundaries, what are their sexual boundaries, how do they get those boundaries respected, what do they do if their boundaries are not being respected. Parents are way more important in this process than they understand. They think their kids aren't listening, but they are, and they're also watching.